What's up guys, it's Martin Reyes, RN case manager, and we're just going over the case tonight, which is a lower GI bleed. In this case study, we got a call from the ER looking to admit inpatient for a patient diagnosed with lower GI bleed. In this case, I usually ask for the medical history. Basically, it's the same format. Medical history, this patient had high cholesterol, COPD, left-sided CVA, and hypertension. You always got to ask for the vital signs. It's basic, but people forget it. Heart rate was 115, blood pressure 142/86, 98% on room air, and respirations of 22. The labs you should ask for every single time because they need to go along with the diagnosis. Hemoglobin you're going to look at, which was 7.1 in this case, which is low. Hematocrit was 24.2. Platelets was high at 553. And most importantly, OB, stool occult blood, was positive. The diagnostics I always ask regardless, and the relevant one here was EKG. EKG showed sinus tachycardia, and they wanted to admit to telemetry level of care. The plan was a GI consult in the morning, and I did give authorization to the hospital because it met criteria with the hemoglobin being low, but the occult blood being a positive test, so meaning there's blood in the stool. Lower GI bleed would show blood in the stool because there's a bleed in the lower GI system. If it was a hemoptysis, if the patient was coughing up blood, then that would be more like upper GI bleed. So in a nutshell, that was a qualifying criteria. The vital signs heart rate showing of 115 does compensate when you have a lower GI bleed. I would have expected a lower blood pressure, but maybe it's not that severe, or maybe the patient's blood pressure is generally higher than, the textbook should say, and maybe this is low for them, 142/86. Respiratory rate is a little bit high, 22, not much, but it does show that the body could be compensating because of lack of blood. You need to get more oxygen within the blood that you do have in your system, so breathing faster makes sense. EKG showing sinus tachycardia would designate patient needing to be in telemetry. And that's it. Technically, you probably could put this patient under observation to save the insurance company some money, and if you're from the hospital side, maybe to avoid you from getting denied for inappropriate level of care. But probably nothing's going to happen here. If the GI consult shows up with a positive colonoscopy or positive EGD, then it's going to go inpatient because some positive test was revealed. But if everything was negative, then most likely they're going to pay you for observation level of care. Well, that's about it. If you have any questions, feel free to ask. My name is Martin Reyes, RN case manager. 3 years in the hospital, 2 years now at the IPA level, and I am RN. If you have any questions, feel free to give me a shout out. Okay, subscribe, like, whatever I can do to help, I will. Thank you.